I want to be honest, I think that the narrative on this reconciliation boondoggle is falling apart. Larry Summers, former Treasury Secretary under Barack Obama, has credibly disabused the public of any notion that this won't be hyperinflationary. It will be. Stephen Ratner, also from the Obama administration, penned a piece in the New York Times today saying the exact same thing. Democrats are driving us off of an inflationary cliff, not to mention debt. Because let's be honest, no one actually believes the CBO score will say this bill is paid for. Of course it isn't. So-called moderate Democrats in the House claimed they made their deal with the socialists as long as the CBO scores the bill. But of course there is no CBO score that would prevent them from voting for this monstrosity. It was all a show, designed to hide the radicalism that has gone mainstream. To make things worse, it's becoming crystal clear that the ultra-wealthy will actually benefit the most from the tax changes in this bill, all while taxes on small businesses will increase sharply. Now, let's talk about something more specific to my home state of Texas and ask this simple question. How is it that every single Texas Democrat is about to vote to cut $250 million to the safety net hospital system in Texas? Do your voters know about this? Of course they don't, because they believe your lies. I was hoping that after the last markup, there would be discussion of taking out this punitive dish cuts. So let me say this again. This would cut almost $250 million out of the Texas Medicaid program, including at least $23 million to Harris Health, a $12 million cut to Texas Children's Hospital, and at least $3 million to MD Anderson. Harris Health has said these cuts would be devastating to their patients, which make up the most vulnerable in Houston. Now, my colleagues on the other side of the aisle listened to our concerns and said that they have a moral imperative to force Texas into their preferred Medicaid program. They claim they're saving lives, our moral betters, after all. Too bad the data doesn't back up that claim. Kaiser, in their vast literature review of Medicaid expansion, shows that Medicaid does not improve health outcomes of those enrolled in Medicaid. It's not just Kaiser. Studies published in the New England Journal of Medicine and Health Affairs both show that the traditional Medicaid program fails the people it claims to help the most. My Democrat colleagues also attempted to downplay the effects this reconciliation bill would have on Texas hospitals, probably because they know it's going to be devastating, with outright lies. So just to correct the record, yes, these cuts are indeed permanent, effective this time next year. And the American Hospital Association rightly points out that even if Texas expanded Medicaid immediately, which is logistically impossible, the, quote, windfall that Texas is expected to receive would not actually correspond to the dish cuts. This means a subset of already financially vulnerable providers would carry the bulk of the weight of the reductions. In other words, the federal incentives that Texas would gain would not actually carry to the people who need the help the most. I'm going to insert this article for the record because it directly debunks the Brookings study that our colleague alluded to earlier. And no, there's no significant evidence of an Obamacare-induced decline in mortality in states that expanded Medicaid, as Democrats have claimed. That is refuted by Northwestern University in a study that I'll insert for the record. The study goes on to show that mortality across expansion and non-expansion states are relatively stable across time, even after ACA adoption. A study published by my alma mater, Harvard University, showed that the best use of Medicaid dollars was on low-income children, which is why the CHIP program actually has broad bipartisan support. We can insert this for the record, too. It turns out that Republicans do indeed support government programs when they actually work. And this is exactly what Texas's Medicaid waiver has done. It's expanded the resources for children, expanded the ways individuals can get care, and made sure that hospitals are compensated for care when they take care of uninsured people. It works. We do it our own way. And that's what this is about. It's about providing the most vulnerable among us the best care. It's not about Medicaid expansion. It's tailored solutions like the Medicaid waiver that Texas uses to solve the problem of where to direct the dollars. At the end of the day, these policies are working for Texas. I understand why Democrats, especially Texas Democrats, are voting for this bill that will cost low-income Texas hospitals $250 million. It is pure, cynical partisanship, punishment to your own home state for not believing the false narrative that you want to push about the effectiveness of Medicaid. Any Texan voting for this bill should be ashamed, and mark my words, your voters will find out about it. I yield back.